Hello and a warm welcome to everybody joining us for day 2 of the 5th Asia Dengue Summit. We're proud to be here. My name is Cameron Rafiq. I'm the co-founder and co-director of the International Society for Neglected Tropical Diseases. We're London-based, so it's a bit of a shock to the system being in Singapore because it's very hot, beautiful place, but just kind of acclimatize with the temperature and everything here. We've had a packed day yesterday and an even more packed day today. For those of you, just as a brief kind of, catch up in terms of what we've been up to here. Yesterday, we were looking at kind of back here with Professor Cameron Simmons from the World Mosquito Program, looking at clinical insights with Professor Bridget Willis from the University of Oxford in Vietnam, looking at kind of dengue pathogenesis, looking at novel diagnostics, novel RDT by the corporate Fujifilm, very interesting discussion there around various aspects of NS1. Moving from that to virus-host interactions, and then we finished the day off yesterday with the digital diagnostics for dengue, the Lacewing project at Imperial College London with Dr. Nick Moser. Today we kind of went through quite a lot of stuff looking at vaccines and the entire kind of vaccine landscape with Takeda, Sanofi, MSD. Some very interesting discussions and sessions coming out of that. Antivirals as well. Really the therapeutics and vaccines kind of end of the curative kind of side of dengue. We wanted to add some balance to it today, so we wanted at the end session to look at climate change, and it's kind of a precursor because tomorrow we're very proud to be joined by Minister Grace Fu from Singapore, who's the Minister of Sustainability and Environment, and so she'll be here tomorrow. So as a precursor to that, we wanted to kind of get everybody to think in terms of climate change, and as we all know, dengue is kind of very uniquely positioned in terms of impacts of climate change. We've got increased temperatures, differences in rainfall, when that interfaces with urbanization, people moving from rural to semi-rural, peri-urban to kind of urban city spaces, that type of urbanization. There seems to be an association in terms of increased dengue incidence and outbreak risk. And that's something that really is going to hit the economic burden end of dengue, and it's something we wanted to pick up on and really attach all of this dengue kind of health agenda to different global health agendas. It's in line with the WHO's NTD roadmap, where they're talking about cross-sector alliances and that type of cross-pollination. And so we wanted to do that. We ourselves had a COP26 side meeting last year. And so I'm very proud and happy to be joined today by our panelists. We've got Professor Raquel Lowe from the Global Health Resilience Team, Climate Change and Infectious Diseases, the ICREA professor and team leader at that Global Health Resilience Team at the Barcelona Supercomputing Center in Barcelona, Spain. We've got Sophie Lee, a PhD student at the London School of Hygiene and Tropical Medicine. We've also got Raquel Lana. Dr. Lana is a postdoctoral scientist in the Global Health Resilience Team, again at the Barcelona Supercomputing Center. And we also, delighted to be joined by Kim van Daleen, the consultant for the Lancet Countdown in terms of the climate change setup in Lancet. So, I think that's enough from me, and I think we'll kind of move to the first speaker, if that's okay. And so I'd like to hand the floor over to Professor Raquel Lowe, the head of the Global Health Resilience Team at the Barcelona Supercomputing Center. So Raquel, over to you, round of applause, and over to you. And I'll just ask the other speakers to back out. That would be great.
Thank you, Cameron, for the introduction. Should I share my screen?
I think that's going to be the easiest way to share your slides from the
Okay, share. Wonderful. Let's see if this works. Okay. So thank you very much for the opportunity to present the work we've been doing both at the London School of Hygiene and Tropical Medicine and the new projects that we're starting now at the Global Health Resilience Team in Barcelona. It's a delight to be able to present to you today on World Dengue Day. We know that dengue has increased rapidly over the last few decades. This has been attributed to a combination of globalization and climate change, with international travel and trade allowing humans and vectors to spread the disease to new areas. We've seen climate change increasing the geographical expansion of the disease. We're seeing warmer temperatures at higher latitudes and altitudes, which has allowed the to have more favorable climate conditions for more months of the year. And we're also seeing more unpredictable and extreme climatic events such as droughts, floods, and storms. And this can impact the timing and intensity of outbreaks of climate-sensitive diseases. And the World Health Organization now estimates that half the world's population is at risk of diseases like dengue. And last year, we published a study where we projected changes in the length of the transmission season for both dengue and malaria using a multi-model approach and different climate change and socioeconomic scenarios. And we found that if we're to continue on a business as usual approach and global temperatures were allowed to warm up to 3.7 degrees C by the end of the century, we could see an additional 4.7 billion people at risk of diseases like dengue and malaria. Whereas if we were to take intensive mitigation actions and keep those temperatures below 1 degree C and meet the Paris Agreement, then we would see that number almost halved. With Tilly Alcagna, a PhD student at the London School of Hygiene, Tropical Medicine and the Red Cross, we published a scoping review looking at the evidence of outbreaks of climate-sensitive diseases following extreme events. And we found that there is substantial evidence of links between heavy rainfall, cyclones, droughts, flooding, particularly with waterborne diseases, diarrheal diseases and cholera. There is some emerging evidence of the links between dengue outbreaks and extreme events, particularly droughts. And this is some work that we have been working on in our team. We're seeing that particularly in urban areas, we can see in this image here, this is one of the largest favelas in Rio de Janeiro. You can see all the blue patches on the image are temporary water storage containers, which are relied upon during times of water shortages. And this combination of population, highly densely populated areas and inadequate environmental hygiene conditions provide the perfect environment for additional breeding sites and transmission of dengue and explosive epidemics. This is an image of the type of temporary water storage container that is installed during times of drought. This is in a city in the northeast of Brazil, and you can see inside the containers the larvae that can grow. And we published a study where we found that a combination of long lag links between drought events and short lag link between extremely wet conditions can provide the optimum conditions for outbreaks. And this is a pattern that we've seen now in Barbados, in Brazil, and also in Vietnam in a paper that we're about to publish. This is an article that we published in the British Medical Journal, laying out a series of strategies to build resilience to climate change against infectious disease threats, a combination of leading by example and reducing emissions from the health services themselves, increasing funding for climate and health. We are seeing some positive movements in that direction from the Wellcome Trust and other funders. And also developing decision support tools using environmental information and building local capacity. This is an example of an operational early warning system that we have put together thanks to a UK Space Agency funded project. In this project, we've been working with the Ministry of Health in Vietnam to collate dengue surveillance data and link it with Earth observations, a hydrological model, and an ensemble of seasonal climate forecasts to produce probabilistic forecasts from 1 to 6 months in advance. And this information is provided on a user platform, which is accessible by the teams operating in the different provinces of Vietnam to provide the probability of outbreaks and the evolution of the season, given different probability thresholds. We're also seeing the dengue is expanding in Vietnam. Particularly, we're seeing more outbreaks now in the cooler areas in the north of the country. And we've also seen that the barriers to dengue transmission that we previously identified in Brazil are gradually being eroded due to climate change and connectivity, which Sophie Lee will present in her presentation. So now our group has joined the Barcelona Supercomputing Center. This is an image of Mare Nostrum, which is one of the most powerful supercomputers in Europe. And we have established our new team, the Global Health Resilience team, within the Earth System Services Group. So we're operating alongside climate scientists, software engineers, and knowledge integration experts to build methodological solutions to try and strengthen resilience to climate change through decision support analytics. This is a new project that we've just launched, funded by the Wellcome Trust, called Harmonize. In this project, we are working to harmonize both satellite images and gridded climate reanalysis and forecasts with new strategically collected data from drones and weather sensors, and combining this with local socioeconomic, demographic, and health system indicators and disease surveillance data, particularly in climate change hotspots. So we're focusing in cities, in small islands, in the Amazon rainforest, and in the highlands, particularly in the Colombian Andes. And Raquel, Lana will present some of the work that we will be developing using these harmonized data sets. This is one of our drone images from the team in Peru. This is in the department of Loreto in the Peruvian Amazon. And this kind of detailed information is going to help us correct those satellite images which can't quite capture the ground truth situation due to a combination of resolution or cloud cover. So we're hoping that we'll be able to provide more robust and detailed data sets to help build reliable machine learning and statistical model frameworks. This is another project that we have just launched. This is a Horizon Europe project led by Umea University and co-coordinated by the BSc. And in this project, we're combining the IPCC framing of risk in terms of vulnerability, hazard, and exposure with the One Health approach to dealing with infectious disease outbreaks and zoonotic diseases. And we're working with partners across Europe and in Bangladesh to develop new systems using citizen science data, newly collected mosquito trap data, and also combining this with both historical seasonal forecast and decadal predictions to try and improve our ability to resist epidemics in Europe. Last year, we launched the Lancet Countdown in Europe. This is a project which draws upon the Lancet Countdown global collaboration, which has been going for over 5 years now, producing indicators across 5 different domains, and Kim van Daleen is going to present our new collaboration that we're working on this year, and we expect to have our first annual indicator report published towards the end of the year in line with the COP. And we're producing indicators with the European Climate and Health Observatory, and we plan to have at least 10 of our indicators up on this platform by the end of the year. So if you'd like to read more about our recent projects, we have some news stories on the BSc website. We also have some job opportunities to help us do all this work. So we're advertising right now for a climate and health data scientist and for a climate sensitive infectious disease modeling expert. So please do get in touch if you're interested. And thank you very much for your attention.
Thank you very, very much, Rachel. If that wasn't a call to arms, I don't know what was. Excellent. And I hope the lovely audience that we've got, someone's going to come back to you on that. It sounds such an exciting time to be in Barcelona in terms of this particular area. You mentioned the citizen science inputs as well, so I'm sure that will crop up in the Q&A. Sounds very, very exciting indeed. And thank you very, very much for making time. I think just because of time, we're going to move to the next speaker and then we'll assemble at the end. So just bear with me for 1 second and I'll just pull that up. And so really, I think a round of applause for Rachel, firstly, Professor Lowe, and we are going to move really to Sophie Lee the next speaker from the London School of Hygiene and Tropical Medicine, as you've heard, involved with Professor Lowe's work there as well. And Sophie's going to talk about the role of climate, cities, and connectivity on dengue expansion in Brazil. So over to you, Sophie. Yeah, and we'll back out. Thanks. Brilliant.
Okay. So just to check, can you see my screen okay?
Yeah, that's working well. Thanks a lot.
Okay, great. Yeah, thanks so much. I'm going to present some of the work that's making up my PhD that we've done, looking at the impact of climate change and human movement on the expansion of dengue transmission within Brazil. So, I mean, this has already been, I'm sure many of you already know about this, but there's been a rapid global expansion of dengue over the past 50 years, which has been attributed to rising temperatures and rapid urbanization, which has created extra habitat for the Aedes mosquito, and also increased human mobility, which has introduced the virus and the vector into previously protected areas. In Brazil, dengue is hyperendemic, so all 4 serotypes are co-circulating, and the past 20 years has seen an explosive expansion of the virus. This here shows the dengue incidence rate per 100,000 residents separated by the 5 geopolitical regions of Brazil. And you can see, particularly since 2010, there's been an increase in the frequency and also the intensity of outbreaks across the entire country. And we're now seeing outbreaks in regions that were previously unaffected. So not only are the intensity of the outbreaks increasing across the country as a whole, but also we're seeing outbreaks occur in more and more previously protected regions. So these 2 maps here show the year of first outbreak, which is defined as over 300 cases per 100,000 residents by the Brazilian Ministry of Health. Previous studies have found geographical barriers to dengue transmission. The first is in the Western Amazon, so this is quite a remote part of the country. It was generally only accessible by boat in some areas, but you can see since 2010, this barrier has been eroded, and we found actually that there isn't really a barrier there anymore that we can pin down. The second barrier was identified in South Brazil, which is a temperate part of the country, experiences very cold winters. But as with the Western Amazon, we can see that this barrier has been eroded, and we're now seeing outbreaks occurring further and further south. So in the south of Brazil, we hypothesized that this previous protection was a result of the cold winters that they experience, and that the movement of the outbreaks further into this region is because of the increasing temperatures. So a study found that the Aedes mosquitoes are only able to transmit dengue virus between around 16.2 degrees Celsius and 34.5. And the majority of Brazil is suitable for year-round transmission. It's quite a hot, humid country. But if we look at the south area, we can see that it's not suitable year round, and this is a result of that temperate climate. But if we look at the change from 2001 and 2010 to the second decade of the 21st century up to 2022, we can see that actually the number of months suitable for dengue transmission has increased in the south, particularly in these fringe areas where we're starting to see more and more expansion. So the second barrier I mentioned was in the Western Amazon. As I said, this is a remote region. So to quantify that, we use data from the Regions of Influence of Cities in Brazil study, which is carried out every 10 years by the Brazilian Institute of Geography and Statistics. And that aims to recreate the Brazilian urban network. So they look at the connections between cities and the way in which people and goods move around the country. So if you look at the map on the left-hand side, you can see that each line between cities represents a connection. And you can see this Western Amazon region has a lot less connections when we compare it to, especially to the East Coast, where there's a lot larger cities. Another part of this study categorized each city by its level of influence in this urban network. The highest level of influence was the metropolis. So these were cities that are connected throughout the entire country. It includes places like the capital, Brasilia, very large cities such as Sao Paulo and Rio de Janeiro, and other state capitals. The level of influence decreases down this list down to the lowest level, which is a local centre. And these are essentially disconnected from that urban network. So people tend to just move within them rather than moving to those cities. If we look at this area that was previously protected, you can see that compared to the rest of Brazil, especially, it's really disconnected from that urban network. And that reflects what we see in this left-hand side as well. The only metropolis in this area is the capital of Amazonas, which is Manaus. So to look at the impact of these two potential drivers on this expansion of dengue outbreaks in Brazil, we use Bayesian spatio-temporal models. So we classified, as I mentioned earlier, an outbreak as over 300 cases per 100,000 residents per year in each municipality. And we looked at the number of months suitable per year and looked at that as a driver. We looked at the level of influence of studies. We also looked at the percentage of residents living in urban areas, as we know that dengue is an urban disease, so this is known to be a driver. It's also very highly correlated with access to basic services, so things like piped water access, which we know also plays a role in dengue transmission. And we also included an indicator for whether a previous outbreak had occurred, because we saw that once dengue became established in a region, it tended to continue having outbreaks. We also included these random terms, so a spatial, temporal, and spatio-temporal term. And what these essentially do is they soak up the extra kind of variability in the data that isn't explained by the covariates we've included, and that allows us to look at the connection, the spatial and temporal patterns in the data and generate hypotheses of what we're missing from this model. So our model showed us that there was an increased odds of outbreak in highly urbanized, well-connected cities, which had previously experienced an outbreak and had year-round suitable temperatures. Because we had these random effects, what that allowed us to do was to see how much of this random variation was being soaked up by each of these covariates in turn. So we fit a baseline model without any covariates, fitted another model with each covariate included in turn, and we saw how much each of those random terms shrank towards zero. So if it shrinks towards zero, that essentially is saying it's explaining variation in the data. And we can plot that across the country to see where each of these covariates is explaining the most. And we saw with temperature suitability, we can really see it's quite clearly soaking up this extra variation in the south. So that's supporting our hypothesis that this previous protection and now erosion of the barrier is a result of changing temperature suitability. We also found there was this strange nonlinear relationship between the level of influence. So the metropoles are the most connected, but they weren't actually the highest odds. We hypothesize this is because people tend to travel through regional capitals to reach metropoles, but within our particular model here, we couldn't look at those direct explicit links between cities. So future work is building a model that does incorporate that, and our preliminary results show that the north of Brazil is far more influenced by the human movement aspect, which is what we hypothesized, than, for instance, the south, which we saw could be explained a lot in turn by the increasing temperature. So hopefully I'll be able to present that next time. But thank you very much for listening. I'll take any questions.
Thank you very, very much, Sophie. Brilliant presentation, a lot of food for thought, and very fascinating to see how nuanced it all is when you use the data and dig in. There's some questions coming through already, but I think we'll save those for the Q&A at the end. That's brilliant, and thank you very, very much for showing us that. Brilliant. And I would just like to stop and say thank you to all the audience and give them a bit of a shout out as well. We've got, we're talking here about issues affecting rapid urbanization, the way cities are sprawling, movement of people, all sorts of things. And you're seeing a worldwide audience here. So we've got people from, just a quick shout out from Indonesia, Dr. Suci Ardini Widowaning has joined us from Indonesia. We've got Dr. Margaret Lufong from the Philippines. We've got, I'm just going through, Dr. Ivana Haluska from Paris, I believe. Hi there. And it's a spread from the Netherlands to Pakistan. We've got Sri Indarnini, from an entomologist from Indonesia. It's a very, very large spread of people from Imperial College. Julia from the Infectious Diseases Data Observatory. And it's really interesting to see Dr. Sudath Samawira, the director of the National Dengue Control Unit of the Ministry of Health, Sri Lanka. A fantastic spread of people. It just shows how important this particular global health agenda is and how important it is to attach dengue to this in that sense. So it's wonderful work. Thank you to the first two speakers. And I would say to all the audience, please keep, feel free, the Q&A is for you. So when you get the questions in, we'll weave them in and ask. And I see a couple of questions already in, but please don't be shy. This is for you as much as everybody else. So please keep those questions coming. I think that takes us very nicely to the third speaker, and I'm just trying to pull my thing out of the way. And so the third speaker, we've heard from Professor Lowe, we've heard from Sophie, Lee, and we're going to go back to Barcelona Supercomputing Center to Dr. Raquel Lana, who's going to talk about dengue transmission regimes in Brazil. So Raquel, over to you. If you're there, I think you should be. Yeah. So Raquel, I don't know if you can hear me, but 1 second. There we go. Brilliant. You may have to unmute yourself, your microphone. We can see you. Yeah. I think you've muted your microphone, Raquel. Sorry. No. Okay. Well, it wouldn't be. There. There.
1 second.
We can hear you. We can hear you.
Okay.
Yeah. Okay, so over to you. Thank you for joining us, and I'll back out. All right? Good luck.
All right.
There we go.
Okay.
Brilliant. Yeah, we
Hello,
can see that.
everybody. Can I? Yeah. So, I will talk about dengue transmission regimes in Brazil. So this is a PhD project from Oswaldo Cruz Foundation called Fiocruz, developed by Yasmin Almeida, a PhD student, and she's supervised by Claudia Codesso and me. So this project is an initiative to improve the InfoDengue alert system, an open source early warning system developed by Fiocruz and Getúlio Vargas Foundation. InfoDengue is a semi-automated data collection, harmonization, and analysis pipeline that generates indicators of epidemiological situation of dengue and other arboviruses at the municipal level. Here is the beginning of, InfoDengue site, and there you can find for all information for all municipalities in Brazil, and by week. And here is an alert dengue project on GitHub. For more details, you can access this link. So many questions are still open about arboviruses, and in our InfoDengue group, we have a lot of them, and I selected some are the most important for InfoDengue. Here is, so what's the probability of a large dengue epidemic next year? What are the areas at risk? And when we are talking about arboviruses, other diseases always emerge because of the similar patterns of transmission and because they are modulated by some factors, some common factors like climate, some environmental or socioeconomic characteristics. And in Harmonized project mentioned by Raquel, InfoDengue is also a partner in this project. We will extend these questions for other climate-sensitive diseases and also investigated deeply these open questions. And for the other diseases, so do they share patterns? If yes, which patterns? And the intensity and the period, as in the same period. And so are they modulated by the same factors, and how, and the intensity? So During the last 20 years, several studies about dengue were done and used some mathematical and statistical models, and some of them by our group and partners at Fiocruz and other institutions from Brazil. Main experiments, field experiments were done as well. And this data was used to study in a time series and some other other models mentioned here. But the disease continues increasing and spreading, as Sophie mentioned, for South region. Here, you can see the recent spreading of dengue for the South region. That was, a free region of dengue. And just to highlight, not only dengue, other diseases like chikungunya as well. And to try to improve the alert system, we have this project that from Yasmin, I've mentioned before. And so classifying types of dengue dynamics based on features of the epidemiological cycle in each location has a potential to increase the precision of surveillance and control strategies. In our study, we are able to classify areas according to dengue transmission, to different dengue transmission regimes, range from episodic and persistent transmission. These regimes are related to specific climate characteristics and the population size of each municipality. Here is an example of 6 states in Brazil that will be published by Yasmin. And so municipalities with a persistent transmission that is in this strong yellow have a high and regular dengue incidence with few or no case-free periods. That means every week we have cases. The episodic regime has a low or irregular incidence, and the disease is sustained for a short period. And an epidemic profile will be those that have a seasonal or periodic occurrence and high incidence interspersed with periods of absence of cases. And now we are studying the changes in time and the characteristics that modulate it, and the idea is try to understand if this profile, these regimes change in time, and after that, the idea is to include the other disease in a multi-disease model. So that's it. Thank you.
Thank you very, very much for that, Raquel. Amazing presentation. Already getting some questions coming through on that. It's fantastic. The work is so exciting, and when you see it in a whole, and in terms of the connections to Rachel's work, Sophie's work, brilliant. So I'm sure the future is going to be very bright for this, and it's much, much needed in terms of rebalancing dengue from just the therapeutic side, right? So this is very, very important. That's why I wanted this session. Cannot thank you enough for being part of that. So grazie, thank you very, very much for that. That takes us to the next speaker, the final speaker for the session. I'm just gonna, just 1 second. I'm just gonna make sure that's working. Sorry, Kim, just bear with me 1 second. It seems to have just frozen. That. Okay, and we're nearly there. Okay, so sorry about that. So that it was just freezing. So that takes us to the final speaker for the session. And as Rachel, Professor Lowe mentioned at the beginning, there's some connection there in terms of the Lancet Countdown in Europe, tracking progress on health and climate change, and they'll be coming out with some indicator reports. So I'm very pleased to introduce to the floor Dr. Kim van Daleen, consultant for the Lancet Countdown on that project. So a round of applause, and over to you, Kim, for your presentation. I'll back out. Thanks a lot.
Yes, thank you so much. I'm just gonna try to share my screen. Does it work?
Yeah, it does. I'm just trying to back out myself there. Yeah, we can see your, yeah, there we go.
Okay, you only can see a big Lancet Countdown in Europe logo and my name?
Yes, the title
Okay,
screen.
perfect. Okay, great. Thank you so much. Hi, everyone. My name is Kim van Daleen, and in this short presentation, I will introduce you to the work of the Lancet Countdown in Europe. And I will also share some of the results that are specifically focusing on infectious diseases. So what is the Lancet Countdown in Europe? The Lancet Countdown in Europe is a new transdisciplinary research collaboration that monitors progress on health and climate change in Europe specifically. And this is a collaboration that mirrors the global Lancet Countdown. And this global Lancet Countdown is the collaboration that nucleates lead researchers and policy experts from around the world to track data on the risks and impacts of climate change on human health. So that's what we see here in the center as well. But they are also tracking the way systems around the world are providing adaptation for health, as we can see here, as well as tracking progress towards climate change mitigation and associated health co-benefits, which we can see here. Two other things that the collaboration is tracking is what the financial and economic dimensions are of the transition to a clean, healthy economy, as well as the changing social and political engagement on climate change and health. So this is the broad structure of the global Lancet Countdown that is similar to the Lancet Countdown in Europe. Each year since 2015, the Lancet has published the Global Lancet Countdown Annual Indicator Report, and this effort is now being replicated in regional centers around the world. So if we look at the different regional centers, we have them now located in different key locations around the world, including China, South America, Australia, and the small island development states. And the Lancet Countdown in Europe is actually the latest center of the Lancet Countdown family. And something that is important to realize is that as one of the largest current and historical contributors to greenhouse gases and the largest provider of financing for climate change mitigation and adaptation, Europe responds to is quite crucial for both human health and the planet to climate change. To ensure that health and well-being are protected in this response, it is essential to build the capacity to understand, monitor, and quantify the health impacts of climate change and the health benefits of accelerated action. So therefore, the Lancet Countdown in Europe was established, and the indicators that we are producing in this collaboration are also contributing to the European Observatory on Climate and Health, which is led by the European Commission. In general, within this initiative, we are talking about countries that are part of the European Environment Agency, but we are trying to extend it as well to all the countries that are part of the World Health Organization in Europe. At the moment, we are a team of about 44 different contributors, and we have a lead team that you can see depicted here, which is led by Professor Lowe, and we report on 30 different indicators that are across the 5 domains that I mentioned at the beginning, and we will come back to that in a second as well. Very briefly, to give a bit of an idea of what we are looking for, what we're trying to do with the development of new indicators, is that we're really trying to develop indicators that are meaningful, relevant, scientifically sound, and reproducible, temporarily representative, geographically representative, and reliable and updatable sources. And all of this would allow us to, on a year-to-year basis, track how climate change and health is progressing over different dimensions. If you want to know more about the initiative, you can visit our website, and you can also find more in our latest publication. And like Rachel indicated, we will have another publication that is our first full indicator report published in October, November. So now I will give you a short introduction in the 5 different domains of our Europe report, and also highlight a bit of the work on climate change, on infectious diseases. So in this first section, we know that climate change is already affecting the health of European population. And in this section, we present 11 indicators that track the change in hazards, exposures, vulnerability, and risks for a selection of climate-sensitive health outcomes across 4 indicator groups. So the 4 indicator groups that we're looking at is health associated with rising temperatures, such as heat, extreme weather and climate events, climate-sensitive infectious diseases, as well as allergens. And what we have seen in our report is that heat-related indicators show substantial changes in heat exposure, the ability to safely exercise, and in terms of heat-related mortality. We also see that the frequency of extreme drought events in drought-affected regions has increased in the last decade, and we see that the infectious disease indicators show rapidly escalating climate suitability for water and vector-borne diseases. So zooming in specifically into infectious diseases, or collaboration tracks climate suitability of non-cholera Vibrio, West Nile virus, dengue, Zika, and chikungunya, as well as malaria. And when you look at the different graphs here, you can see that for the different infectious diseases, the climate suitability has been rapidly escalating for the different diseases. And of course, as we are here at the Dengue Summit, we will zoom in specifically into dengue. So we know from the previous talks that accelerated human mobility and increasing climate suitability for arboviral diseases are together driving the emergence of arboviruses in Europe. And this is exemplified by different recent outbreaks in countries as Spain and France. And within the indicator of the Lancet Countdown in Europe, we use a mechanistic model to estimate the basic reproduction number and length of transmission season for dengue, and that is combining information on temperature, rainfall, mosquito abundance, and human population density. And the second part of this indicator is monitoring the estimated rates of imported dengue cases to European regions. And this was done by estimating the yearly number of dengue-infected people that are moving from dengue endemic regions around the world into locations in Europe where conditions are suitable for dengue transmission. So when we look at this graph here, we see that on the y-axis, the R0 is represented for dengue by the different European regions. So you can here see which color the different European regions is. And on the x-axis, we see the time between 1951 and 2020. The black curve that is indicated here shows the estimated relative change of yearly number of dengue cases imported per NUTS3 region to transmission suitable locations in Europe. And overall, if we look at the data, what we see is that compared to the first part of the data that we have, in the second part of the data, the R0 has increased by 17.3% in Europe. We also see that the greatest upward shift in transmission season was observed in Central and Eastern Europe, with a gain of about 0.2 suitable months for dengue. And likewise, we can see here again in the black line that over 1990 to 2019, the number of estimated imported cases has increased by about 600%. Then I will shortly introduce you as well to the 4 other domains that we have to give you a broader idea of what the Lancet Countdown in Europe is. So the second section of our report is focusing on adaptation planning and resilience for health. And within here, we have different indicators that are both looking at the implementation as well as the implementation of early warning system, monitoring, and response systems for health. In the third part of our report, we have a section of 7 indicators that is tracking European efforts to mitigate climate change and their associated healthcare benefits. And we do that across 4 different domains, and that includes energy systems and health, mortality impacts of ambient air pollution from fossil fuel use, sustainable and healthy transport, and food, agriculture, and health. And you can see that here depicted as well, where there are different target sectors for mitigation policies, exposure pathways, and then health outcomes and co-benefits of mitigations that we're exploring within this group. Then the fourth group of our collaboration is focusing on economics and finance. So the first set of indicators employs a range of different methods to estimate the healthcare costs of morbidity and mortality that may already be incurred by European populations due to climate change, whereas the second part monitors the economics of the transition to zero carbon economies. So one of the indicators here, for example, is tracking the economic losses due to climate-related events in Europe. And we see here quite a big increase, which was of course a result of the European floods last year. And the last of our indicator section is focusing on the tracking of domains that are influencing Europeans' response and reflecting the societal impact of health consequences of climate change. So we here have 4 different indicators that assess the engagement on climate change and health by scientists, by individuals on social media, by politicians, and by the corporate sector. So all in all, we have 30 different indicators across 5 domains that are tracking climate change and health in Europe. And we have our first indicator report being published in October, November. And with that, I would like to thank our collaborating institutions. And that is the end of my talk. Thank you so much.
Thank you very, very much, Kim. I mean, the feedback you're seeing on the screen, I mean, thank you all. I mean, that was a fantastic presentation and fantastic presentations. Everybody's coming back with Julie Halder. This is really interesting work. All the presentations have been. Thank you so much for these talks. Dr. Ivana Halaskova, these are brilliant, and some good questions coming through. Everybody's kind of giving a round of applause really for that. A lot of food for thought, a lot to unpack. I'd like to call all the speakers back. If you could all come onto the screen again, we can have a short Q&A, if that's okay. There are questions from the audience as well, and I'd like to start off by firstly saying thanks again to everybody. You got a lot of people thinking. It's great. And what I wanted to ask, and this kind of ties in with some of the questions coming through, the linkages that you're all talking about in terms of climate, vector-borne diseases, as they become better understood, you know, whether that's kind of on an empirical basis or, as we've seen with these increasingly, how to put it, refined models, they're going to get more nuanced and more kind of in depth. How have you found the kind of stakeholders, let's say in VBD, vector-borne disease control, are they using these your kind of recommendations? Are they using or they're incorporating the dynamics into their kind of work? You know, what's your experience of that? How are we going to increase that uptake in terms of your work being used in those kind of settings? And that's a question to everybody. And the reason I'm asked that before is that a few of the people on the chat have been asking, you know, what are the communication challenges, the communication frames? And it always hits me that what you're saying and proving makes perfect sense. Absolutely. You can see it happening. I've just gone for a walk around here. You can see it happening. But who's listening? You know, what's the policy trigger? What is the lingua franca? What's the frame you're going to put that into? So try to weave. There are quite a few people asking that kind of question. Khurram Wahid, Dr. Khurram Wahid, Dr. Alex Habwa is asking that as well. And so I just wanted to kind of ask that to you. What's your experience of your work being used in let's say, vector-borne disease control? How do you increase that? I'll ask Professor Lowe first, and then move it to everybody on the panel.
Thanks so much. So, you know, most of our work, particularly the new projects we have now, the stakeholders are very much embedded in the projects as partners. We're particularly working with, as Raquel presented, InfoDengue is one of our key stakeholders in Brazil. So there's already a nowcasting system in place, and the hope is by incorporating the climatic indicators and forecasts of those, we can improve the lead time and the time to intervention, and really help the sort of municipal governments be able to intervene in advance and know which areas are most at risk from increasing probability of outbreaks. As well with the Lancet Countdown in Europe, all our indicators have been co-designed and reviewed by our stakeholders, particularly the Environment Agency. So we're working very closely with them and making sure that we're just developing indicators which they feel their countries feel they need to help make their decisions and build resilience in Europe. So yeah, I'll let everyone else comment.
Great answer, you involving them in the right from the beginning. So that's a great answer. Would anyone else like to comment in terms of your experiences of your work with the stakeholders?
I could elaborate a bit more on the Europe side, if that helps.
That would be brilliant, Kim. Thank you.
So yeah, just to add to what Rachel was already explaining, something that I think is really nice that our work is doing is that it's directly feeding into the European Observatory on Climate and Health, which means that it is directly accessible by policymakers because people can explore our data through visualizations on their platform. And we also create different policy briefs across Europe in collaboration with local medical associations, and then tailor the messages specifically to the governments in those local governments. So for example, we have policy briefs targeted at Germany, the European Union as a whole, the UK, etc. So that is one of the ways that we try to bring it directly to the government officials.
Fantastic. Dr. Adiata Ramadona was saying brilliant work and that fantastic presentation. Thank you so much for sharing. And he was wondering about your experiences in terms of this exact thing, communicating your research insight to the policymakers. I think you've answered that in terms of these indicator reports, dashboard, and various kind of, interfaces that people can use. So that he was asking about best practices. But thank you for answering that, Kim. Would anybody else like to answer or add to that? I'm going to ask Sophie something, simply because someone's put something in, and I suppose it's kind of along the lines of that, but a little bit specific. Dr. Alex Abiwa is asking to Sophie Lee, how can we characterize or categorize human movement that translates into dengue transmission?
That's a very good question. It's what I'm trying to work on at the moment, because the issue with so dengue generally, there's lots of different ways that human movement affects it. So a day-to-day basis, people are, commuting during the time when these vectors are biting people. So it can be on a short scale. So I think it very much depends on your particular research question, because mine's over a longer period. Mine is more characterized about the long distance movements or the kind of continuous movements. So what I've been using at the moment is census data from Brazil, which shows the work and education trips that people take. And although it isn't necessarily capturing all of the importation that will be happening, I think if you can show which of the areas are most connected kind of on a continuous level, that's what I'm hoping to have in there, but it's very dependent on the research they do.
Fantastic, a great answer, and as you said, a very good question as well, so great stuff. Dr. Khurram Wahid is asking, and this is very interesting because I think, Rachel, you mentioned at the beginning, you mentioned that there was something that you mentioned in terms of using citizen science in Bangladesh, OV traps, and kind of integrating some of that data in. Now he's asking, how would you, or what are your thoughts, I'll just paraphrase this, regarding countries like India, Pakistan, Bangladesh, in terms of they have the same kind of unplanned urbanization, rapid urbanization issues that you've been discussing across this session. Would there be any kind of specific kind of, you've mentioned Bangladesh, is citizen science the way forward to bring the public in? Is that the kind of main kind of way that you would tackle those kind of countries, the nuances there?
Yeah, we're collaborating in our new projects with the Mosquito Alert Collaboration. So this is a citizen science approach which allows users to take photographs when they see vectors, and it helps through sort of verification through professional entomologists. We can identify sort of new vectors, but it's been particularly useful for mapping out the distribution of the Aedes albopictus mosquito across Spain. It's had a lot of uptake across the rest of Europe now, and it's also it's a global product, so it can be used anywhere. And there are certain partners. We're going to be working with our partners in Bangladesh as well. So that's one of the ways that we can use citizen science through helping to identify new mosquito species or understand the distribution in general. We're combining that also with smart traps data and making sure we're deploying traps in the most relevant areas for transmission, as well as weather sensors, because often we find there's a big disconnect between where we're monitoring weather conditions. Often that happens at airports rather than in the places in the communities where disease transmissions are actually happening. So we're trying to make sure that we can collect the most reliable and relevant ground truth data to help us inform and build more robust models.
Brilliant answer. Thank you for that. I'm going to ask the same question to Raquel because we've kept, we just want to involve you as well in terms of the Q&A. Your work, obviously, Brazil, in-depth look at Brazil. There are some, I suppose, and Kuram Wahid saying thank you, Rachel, for that. What would your your work is specifically Latin America. Any thoughts on this in terms of nuances to different countries? How transferable or transposable is your work?
So yeah, I'm working more specifically in Brazil and in InfoDengue. And so now I think in Harmonize, we have this idea to extend our experience for the other countries. I think that is possible, but it's necessary to be more to have a system of flexible to attend to the difference between the data and the organization. One thing that we know that depends the country have a different structure of the data and of the health organization as well. So so at that time, I don't have the experience to work with other countries, but I'm trying to understand this new organization in Harmonize. That's my new goal. To understand well this, and I hope to share this experience in the future.
Brilliant. That's a great answer, and we appreciate that. Brilliant. I suppose another question here, and we saw this with COP26. We had a side meeting. I think, Rachel, you're part of that, and the OIE were there as well at the COP26. We had that session there. Marianne was the chair. So a kind of question there, how can we leverage the growing there's definitely growing interest and mobilization in terms of broader public interest, in terms of climate issues. You've seen the school strikes and everything across Europe. It's worldwide. People know this is an issue. They care about it. There's that momentum is there. How are you going to leverage that in terms of boosting advocacy? Because this part of this definitely is a communication challenge, and that's been highlighted in some of the answers and some of the work and the direction of it. How are you going to use that momentum that's out there to boost advocacy for neglected tropical diseases that are vector-borne? Specifically, let's say dengue. We're in a dengue meeting. How are you going to leverage that momentum? What are the plans outside of citizen science? What are the plans, or how do you see that happening?
I think increasingly climate change has been recognised as a health problem, and I think that's really what raises the interest and the concern of the population. We're sort of moving away from the more sort of abstract aspects of climate change and really bringing it back to how much it's impacting our daily lives and our health through many sort of direct and indirect routes. We can see extreme heat causing many people across the globe just unable to work. It's far too hot to be able to be out in the field to do construction work. We're seeing emerging diseases emerging in new places, and it's really playing a role in everyone's lives in both low middle income countries and high income countries. And I think as a scientific community, we have a responsibility to raise awareness about that, to where we can lead by example, and really to make sure that we communicate our work as much as possible. Let's not have our results just stuck in scientific publications, but try and advocate and engage with the public and policymakers as well.
Fantastic answer. Yeah, and that is definitely what's needed. I'm here today. Kuram Wahid just made that point, so I'll just elaborate. He said something, I just saw it pop up and it's gone away again, but he's saying there's a lot of advocacy for vaccine hesitancy, misinformation. There's quite an orchestrated campaigns to counter all of that kind of stuff. So the infrastructure's there, and the people's mind. Is that one of the partnerships that needs to happen, perhaps? Getting these multinational kind of companies involved. We're talking here about governments and this kind of thing at the moment. What about the big corporate players that are inside these kind of spaces, the drug producers, the diagnostic companies? Is that someone you can bring in? Because they're trying to frame their argument for using a vaccine in many different ways. Some of that socioeconomic, and some of this, would impact that argument. yeah, have you ever considered that, like these bigger kind of companies and that kind of thing, as someone to communicate with? I suppose I'll ask Raquel, Lana, because you've got this system that you just put up there in terms of the communication setup that you've got there. Are they in the crosshairs, people who are active in dengue but at the therapeutic end? So people who are involved directly with the communities that are affected, but from the medicines end, the therapeutic end.
Sorry, I couldn't understand well your question.
Okay, it's no
So
problem.
sorry.
I was just asking, I was just asking the partnerships we've been talking about for communication, government-based or schools or people, the public, bringing them in to citizen science, that kind of thing. But how about the corporate kind of world, the people who are already in dengue, let's say, active in the space, but they're making medicines and vaccines, and underneath them there are communities and hospitals and clinics and everything. Is that someone that you could potentially produce a communication frame for this kind of work based on
Yes,
the move? Yeah,
yes,
based
we
on the
have
move.
yes, we have a journalist in our group that helped us and instruct us how to communicate and how to do it with different publics, general public or sometimes for the stakeholders. And we have some channels to communicate with people, and we have as well engagement activities that she helped us to organize. We have, we have a course for distance learn course
Yeah,
that capacity people to use InfoDengue, only capacity stakeholders, but it's free for all population. It's a very, how can I say, it's a funny course,
yeah,
it's interesting to do the course. And we have as well an engagement with some communities like favelas in
yeah.
Rio de Janeiro, and we try to keep close with these communities because
Yeah.
they have many initiatives as well to promote the dengue prevention. And yes, we have several activities like this.
Yeah. It's so encouraging to hear that, Raquel, and you'd be surprised. I mean, I'm saying all this because today, as I said earlier, the kind of focus area really was the vaccines, antivirals, the therapeutic end. But even there, their entire argument has been we've got to keep it at a local level when it comes to the communication strategy and involve those communities. So there's a lot of resonance in terms of that and what you're saying. So that's very, very interesting. And the course that you've mentioned, can people just email you directly and find out about that and join that course? You've mentioned there's a course there.
I will write the link here, but it's in Portuguese. I don't know, if it's possible to translate, but it's free.
Yeah,
You just have to
yeah.
do your inscription and start the course.
I
It's
got
free. I
panicked there.
think,
I thought you were about to ask me to translate there. You don't do that.
yeah, we don't have
Press the red
another.
button. Press the red button. Yeah,
Yeah,
no, brilliant. Well, I do hope people, there is a course there. I'm sure everyone heard that and seen
I
that,
will
and I'm
put
sure
the
they'll get
link
in touch.
here.
I hope they do. That's brilliant. We've sadly come to we're kind of 3 minutes over, so I do apologize to everybody who's running off. That's a fantastic session, so much to unpack. I don't think an hour has done it any justice, really. We've just got into things. There are loads of things we could wanted to kind of speak about, and I'm pretty sure we'll have the chance to do this again in a different session later on in the year. We certainly are making this as part of our own, the International Society of NTDs, it's on our agenda for certain. So we have our own climate change and NTDs meeting in October, and we'll keep you all posted about that. But I'm pretty sure we'll talk again. So Rachel, it was good to bump into you in London on that street on that day when we saw you near the London School. So it was good. From that hello, it's gone to say thank you very much for that. A lot of the people are coming back and saying thank you, wonderful presentations. I'm sure you've seen that on your screens as well. Really superb presentation. Mr. Amara, clap for you, Kim, after your excellent presentation. Dr. Ivana, Haluskova, Bolter, excellent presentation. Ivan, I saw a lot of questions that you put through. I'm just seeing them now, but we were out of time. I do apologize, but thank you for that, and thank you for joining. It's going to be an excellent day tomorrow. We've got the Minister, actually, as I said earlier, of Sustainability and Environment, Dr. Grace Wu, who's basically looking at dengue from that optic here for Singapore tomorrow. So I think a lot of these kind of things are going to come into that. And hopefully in the future, we'll be able to organize something with all of that kind of cross-section in there. Just wanted to be a massive thank you to the panelists, okay, to Professor Lowe, to Sophie, to Raquel, and to Kim. Thank you very, very, very much indeed. Excellent. And I wish you the very best for your work. I'm sure it's going to be an area to watch and track. Everybody's kind of saying thanks. People are saying we need a world collaborative team. Well, there you go. There you go. That's why we're trying to get World Dengue Day off the ground. Everybody, we were spearheading that, the kind of advocacy campaign for that, and we're trying to lobby the UN and WHO to actually recognise that as an official World Day. So there's a petition out there. It's got about 29,000 people on there signed. So it's there. The movement's going in the right way. And it's sessions like this that make that possible. So thank you very much. I think enough from me, and I think a round of applause, and we'll just I'm going to have to say goodbye. I'm hearing I've got to get out of this room as well, so that's the other thing. So thank you very much, guys. Take care of yourself, and we'll look out for these Lancet Countdown reports when they come out, and I'm sure we'll talk again when they happen as well. Best of luck with the work. It's very exciting, so it's brilliant. So thanks a lot. Okay, everybody. Cheers. Thanks. Terima kasih to everybody in the region, and nice one, everybody. Take care. All right. Not good at goodbyes.
Thanks a lot, Carmen.
Bye bye. Bye bye.
Take care. Bye.